I'm Dr. Donald Moore. I'm a primary care physician in Brooklyn. I've been practicing for a really long time, but I could tell you, this COVID-19 pandemic is the most remarkable thing that has ever happened in my practice. When I started practicing medicine, I won't say when, but the HIV pandemic just started. And I spent the first 10, 15 years of my career being an HIV treater. It was a remarkable time. I never expected that to be the course of my medical practice. And, after 30, 40 years of practicing medicine, I'm getting ready to hang up the, hang up the shingles and, turn the lights off. Then comes COVID-19. That became the most remarkable thing in my life. I saw people die. I felt helpless, like most everybody else in the beginning of that pandemic. We knew it was coming. We heard about it. We heard it was over there, somewhere in the Far East, maybe China, whatever. Yeah, we knew it was coming. And then when it came, we acted like it was something else. It wasn't there. Denial. But then we had to face the reality. I saw my patients die. I would make house calls, and a few hours later, patient was dead. I would admit patients to the hospital. A few hours after admission, the patients died. I would get calls from families. My mother just died. My husband just died. It was difficult. At the beginning, the onset of that pandemic, and obviously, I knew about pandemics when I started practicing medicine. As a matter of fact, not only did I get my medical degree from Yale School of Medicine, I did a master's in public health at the School of Epidemiology and Public Health at Yale. So I thought I was prepared. I thought I was ready to deal with anything that came in medicine. But I was not prepared for a real pandemic, the die-off of so many human beings. I'm sure you heard the news. The funeral parlors really had no space for people. People were put in trucks outside the funeral parlor, and the neighbors were passing by smelling the dead bodies. It was real, and I was a part of that. It was just an amazing time. It has made me certainly a different doctor than I thought I would have been. So let's go back to March of 2020. March of 2020 was when COVID hit Brooklyn, hit New York City. As a matter of fact, I remember being in Washington, D.C. in, mid-late February. And I sent my daughter a text. I said, listen, follow this. This was a website that talked about COVID-19 as it traveled across the ocean to Europe and was on its way to the east coast of the United States. And I said, follow this, because she was interested in public health. As a student of public health, I felt that somehow this was within my wheelhouse and I wanted to follow this. But I didn't think of managing this as a physician. I didn't see myself in the reality of a pandemic. Well, somewhere in mid-March, basically they shut New York City down. I was in Brooklyn practicing medicine. That's when the calls started coming in. Patient sick at home, patient sick, required hospitalization, and so on. Well, imagine, as a doctor at that time, the only way that I could diagnose COVID was clinically. I had to get a case definition from the CDC. The CDC said, look for fever, look for cough, look for all of these things. But, that's not how I practice medicine. The way I practice medicine was, you told me you had chest pain, I would get an EKG, an echocardiogram, I would do a stress test, and I would diagnose heart attack or something like that. Here it is now, all of a sudden, you're taking me back, way back to the point where I had to use the clinical skills. Of course, imagine going into a COVID patient, no mask, no gown, no covering. You're not thinking, and then you're not thinking that you could get harmed, you could get hurt, you could get COVID, you could die. You're not thinking like that. You're thinking, well, I need to make this diagnosis. But then you see your colleagues start dying. Oh, wait a minute, I can really die here. I remember actually writing up a will at that particular time because I did feel fear. I remember my wife saying, well, do you have to go to the hospital? Well, of course I didn't have to go to the hospital. In the old, in the 14th century when the pandemic came, what the doctors would actually say to their wealthy patients, clients, whatever they were at the time, is "Cito longe tarde," means go quickly, run away. This is a pandemic. Go far. Don't stay around here. This is where the pandemic is. And guess what? Don't come back too soon. But that's not what doctors were trained to do. We, like firemen, if there's a fire over there, you run to the fire. So I had to go to the hospital. I had to go in and make my house calls. I had to see patients. But eventually the whole place got locked down. So we weren't even seeing patients in our office. We started using a variety of video calls. I remember one of my first video telehealth visit occurred on WhatsApp. Actually, it wasn't WhatsApp. It was FaceTime. I didn't even have WhatsApp back then. I had to download WhatsApp to my phone just so that I could reach my patients. I had to get my patients to download all of those things. So it was a very, very unsettling, unusual time. So we didn't think it was a big deal not to have masks because the CDC, Anthony Fauci, said, well, masks aren't that necessary. We didn't think it was a big deal not to cover yourself with a gown, but then we saw the images coming from China. We had some early reports of how the pandemic was being dealt with, and they were covering up. They were covering up the same way we cover up when we treat highly contagious, highly virulent diseases such as Ebola. So things started really changing. Anyway, fortunately, things started to look a little bit better. We did get a few masks. It's so funny, initially they told the population not to wear masks, leave the masks for the doctors and the medical professionals. Eventually they told the whole population to put a mask on. COVID-19, like influenza and like so many viral illnesses, these diseases are crowd diseases. And Brooklyn, New York City, is a crowded place. So we really did need our masks. We really did need the distancing and protecting ourselves. So we sort of eventually got that down. They locked the place down. Things got to a stable state. So we're talking March, April, May. So we saw the first epidemic curve. We saw all these people get COVID. We saw all these people die from COVID. And then things looked like it was getting better. The epidemic curve was going down. And it was about that time that my Congresswoman Yvette Clarke, had called me. She knew my background in epidemiology, public health, and my practice of medicine. And she asked me, if we could look into some of this, because by then the federal government in the United States was actually looking at this disease and making strong efforts. That's when you heard about things like Operation Warp Speed. And we knew then that millions of dollars, maybe billions of dollars, was going to were going to be thrown at this disease, and finally we were going to get the armamentarium to deal with this, what was now obvious, really serious pandemic, probably the worst that we were going to see for certainly this century. Well, we got started. I put my team together in Brooklyn, the COVID-19 team. We call ourselves the team, and we started looking at the government response. Well, guess what? The government response, by the time we came out with our first report, the government response was obviously inadequate. There was a lot of politicization of the whole thing. You know, there were arguments on whether you should wear a mask or not wear a mask. Just like there had been with all the previous pandemics. In 1918 it was the same thing. There was a big argument on whether you should close the schools, when to close the schools, all of those things. But as a society that's civilized, we sort of work these things out one by one. Things eased a little bit, but we did put our report, and we said that we needed to do a better job. We needed to improve our infrastructure. We needed to have had, at that time when the pandemic hit, we needed to have had a public health system that could respond, and we didn't. Well, things got better. It continued to get better until, of course, the fall came and people started mixing again, mingling again. Thanksgiving, people started flying on planes and gathering. And of course, we saw another wave. This wave was actually larger than the first wave, which had killed so many people. But this second wave was more widespread. It went across the country. So it came down the east coast of the United States, went into the southern states, then went towards Texas and went towards the west, and then eventually started to seep into the middle of the country. And that's how a pandemic moves. A pandemic doesn't just sort of come and smash everything at one time like a hurricane. It's not exactly like that. It starts in certain areas. And remember, this virus was a crowd disease. It was spread. It is being spread by respiratory contact, respiratory inhalation and contact. As a matter of fact, we know now that this virus at times is aerosolized. So walking into a room that's not properly ventilated could put you at relatively high risk. But by then we had figured it out. We'd figured out that we needed to ventilate our spaces, we needed to cover our faces, we needed to keep distance from each other. So we came out with our report, and we did a second report. The first report looked at what was going on in Brooklyn. The second report looked at what was going on in the United States. And whatever occurred in Brooklyn just replicated itself over and over in the rest of the country. The same arguments kept occurring over and over. And that was no surprise, because that's the way it was in 1918. That's the way it was in 1346. The government never got itself together until so many people had died. The public health officials either were ignorant at the onset, or they were timid as they got the information to enforce the way things should go. So, if that was the end of it, then we would say this was a remarkable pandemic, and we would, close the book, and we would say we'll wait for the next one. But that's not the end of it. The whole society has changed. The society will change even further, and things are going to be quite different than they were prior to January of 2020. So, as a practitioner in Brooklyn, New York, I have a great legacy that preceded me. Brooklyn has had numerous pandemics. Brooklyn is a crowded space. That's where crowd diseases take hold. And many of you have heard that at one point of this COVID-19 pandemic, Brooklyn was the worst place to be in the whole world. Well, we now have 200 years of organized medicine in Brooklyn. I am a member of the Medical Society of the County of Kings, and in 2022, the Medical Society of the County of Kings will be celebrating its bicentennial. So the society was formed in 1822. Now, obviously, if I were alive and a physician in 1822, I would not be a member of that medical society because slavery existed back then. But fortunately for me, and fortunately, hopefully for my patients, I have attained a certain amount of, I would say, position in the Medical Society of the County of Kings. I actually chair the Bicentennial Celebration Committee. In addition, I chair the task force on COVID-19 of the Medical Society of the County of Kings. So that sort of put me in a unique place to study this disease, to look at how this disease impacted not just the population of Brooklyn, but the physicians that practice medicine in Brooklyn. So I told you about the fact that we did a couple of reports for the United States Congress on the Congresswoman Yvette Clarke, but in addition, we also, as a society, produced our own reports. We looked at things like testing for COVID-19, and of course, we were very early in assessing the impact the vaccines would have, and how the vaccines would impact the pandemic. It's not clear how the vaccines have impacted this pandemic. I know you may have heard things to the contrary, but it really is not clear, because if you look at those pandemic curves, they really haven't changed. They look just like the pandemic curves that occurred in 1918. They look very similar to pandemic curves that occurred before all of them. And remember that the vaccines are limited. They don't solve the problem of a pandemic. They are part of the treatment for a pandemic. So it's really at this point unclear where things are going. You've heard of variants, all these different variants. When the vaccines are made, they're made for a particular variant, usually at a much earlier time. By the time the vaccines are rolled out, the efficacy is not to the current variant. The efficacy is usually directed towards an earlier variant. So it's again really unclear how vaccines will change the course of this pandemic. What we do know is that pandemics don't last forever. There is an immunity that is acquired by the population, and many of you have heard the term herd immunity. Herd immunity comes from immunity acquired from getting the disease. It also can occur from the additional effect of vaccinations. And so no matter how virulent, how widespread a pandemic is, there will come a time when the pandemic will either wane to a point and end. Some pandemics come year after year. In the 1346 Black Death pandemic, the bubonic plague, that pandemic started in 1346, went on to 1352, and then it sort of waned, ended for a while, but it came back 4 or 5 years later, and it kept coming back every 10 years for almost 100 years. And it went on and on for the past 400 or 500 years. And we see the same thing with influenza pandemics. Influenza, has been around a long, long time. As long as we were living together in groups when agriculture came, we didn't know it as influenza back then. As a matter of fact, in 1918, we didn't know that that was a virus that was causing influenza. As a matter of fact, many experts thought that it was a bacteria that was causing influenza. You may have heard the the bacteria referred to as Haemophilus influenzae because they thought that was the bacteria that caused influenza. It wasn't until almost 20, 30 years after the 1918 pandemic that we finally settled the score that this was a filterable organism, meaning it was actually so small a thing that it went through a porcelain filter. That's what they mean by filterable organism, meaning smaller than a bacterium that caused the influenza pandemic. It took us, we didn't get a vaccine for almost 40 years, 50 years after the influenza pandemic. We didn't get you heard that, we didn't get a vaccine for 30 to 40 years. But they gave many vaccines during 1918 thinking that they were treating that particular infective organism. We gave vaccines for pneumococcal diseases, thinking that we're treating influenza. We gave vaccine for diphtheria, thinking that we're treating influenza. As a matter of fact, when you read some of the literature at that time, it tells you that the doctors felt that they could just crush up some tissue from the infected individuals and inject it into people, and they thought it worked. And they would do, well, higher and higher titers of this material that was obtained from infected people. So, and we all thought it was working then. Not we, I wasn't there, but the doctors then thought that was working. And you would see reports to say, yes, the vaccines are working. And these were the experts that were saying this. We know better today. So my point is, not only do we not know when a pandemic will end, we're not even sure of all our treatments. We're not sure of a lot of the things we're doing because, you know, tomorrow we find out how ignorant we were today. It's not today that we know all of this. And that's information, that's knowledge. That's what I have learned. That's what I've learned from studying pandemics going all the way back from the 14th century to now the 21st century. In 1346, 1347, when the Black Death, the bubonic plague, hit Europe, the doctors then didn't know what was the cause. The germ theory had not been established yet, obviously, so we didn't know anything about germs and bacteria. So it was miasma, foul air, bad air, you know, going back to Hippocrates and Galen. That was the philosophy of medicine at the time. So the doctors didn't know. As a matter of fact, I mentioned earlier how when a pandemic hits, a lot of people die. So many people died in Europe that the probate courts, they were overwhelmed. People started inheriting property and many people walked away. Because if you inherited a piece of land and you had nobody to work the land, but you had to pay taxes on that land, you could be in debt even though you have inherited wealth. So it really turned the society upside down. And it took many, and then it didn't just come and end. It would come, you would get a wave, and then it would come back again. And the population in Europe really dwindled. You know, maybe one might say, you know, according to the Malthusian concept, you know, that was necessary. We needed to thin the herd. We needed to decrease the population. And that's exactly what happened. So pandemics really haven't changed, have they? It was the same thing in 1918. 2 years before the 1918 pandemic in New York City, there was a poliomyelitis pandemic. And the physicians, the doctors at the time, the experts, they wrote stories like the bacteriology of poliomyelitis or the bacteriology of the poliomyelitis pandemic. So we really didn't know, even though at that time, doctors at the Rockefeller Institute, as it was known then, had already identified that this was a filterable virus that caused poliomyelitis, but only some doctors believe that. Some doctors still believe polio was caused by a bacteria. So again, we see what's happening today in the COVID-19 pandemic, where there is disagreement, and of course, posterity will give us the answers. Just like we know now in 1918 that was caused by a virus. We know that back in 1347, this pestilence that hit Europe was caused by a bacteria, Yersinia pestis, not discovered until hundreds of years later, in the late 1890s, before we actually figured it out. So we're going to figure out a lot of things about COVID-19 10 years from now, 30 years from now, 50 years from now, 100 years from now, and we're going to be wondering, what were we thinking then? So how did this 1918 pandemic start? As with any pandemic, there are multiple competing theories of the origination of the pandemic. However, I think many experts believe this started in Haskell County, Kansas. The story goes back to a general practitioner, Loring Minor, who practiced in this rural county. This goes back to the horse and buggy days, maybe a few motor cars. Doctors made house calls widely at that time. This doctor noticed a cluster of respiratory illness in his county. He really was impressed on how serious this illness was, and eventually actually wrote this up and sent it to public health reports. If the disease had just remained in that rural county, that would have been the end of it. But Haskell County was close to a major U.S. Army base. Well, they didn't call them army bases at that time, cantonment. Remember, there was a war on. World War I started in 1914, and we're talking about 1918. The United States had just entered the war, and so we were gathering individuals, young men from all over the country, and they were gathering in these cantonments, 50,000, 80,000 young recruits in this area. Well, it so happened that whatever this cluster of respiratory diseases was like, whatever that was, it actually entered one of these camps, Camp Funston, which was a part of Fort Riley. And many of the recruits moved from there to other larger cantonments, or they actually went to Europe. And it's believed that this was back in April of 1918. We saw the disease then spread throughout Europe. The virus, which we know now it was a virus, actually went through many different, changes, variations, and whatever that disease was in Haskell County seemed to have gotten worse. Well, after percolating through Europe, if you think of it that way, the virus percolated, eventually boats, ships started coming back from Europe to the United States. So things quieted down after April of 1918 in the United States. That was the first wave. Somewhere in late June, early August, we started seeing a resurgence of this respiratory virus illness, or it was not known to be a virus at that time, this respiratory illness. And the ships started coming back from Europe with people that were ill. It was recognized, so many of those ships were quarantined when they arrived. But there was a particular situation that occurred in Brooklyn. Now remember, Brooklyn is where I practiced medicine. Brooklyn was an established city at that time. Well, it's no longer a city on its own. Brooklyn was originally a city up until 1898, 1899. Then it became a part of New York City as one of the 5 boroughs. Well, Brooklyn, as you know, is a port city, and eventually a port borough. And there was this Norwegian freighter, Norwegian steamship that left from Norway. So this Norwegian freighter steamship picked up passengers from various ports in Norway. And apparently there was an outbreak of this respiratory illness on this ship. According to the officers of the ship, when they were interviewed by the New York Times, they actually indicated that they recall specifically picking up a particular woman in one of the major cities, Bergen, in Norway, and she got sick and she died. She died on the ship. And subsequent to that, the assistant chef that had attended her also died. As a matter of fact, 4 people died in that transatlantic voyage. When they got to New York, despite the fact that there was over 200 people sick from some respiratory type virus on the ship was not held in quarantine. The officers at the ship did report what was going on, and the ship was met by ambulances and medical people who took them to the Norwegian hospital in Brooklyn. The doctor that attended 10 or so of the 200 infected people diagnosed pneumonia and concluded that this was probably not a contagious disease, and if the people on the ship got sick, it was because of their previous malnutrition. Of course, they had not acknowledged that there was a lot of malnutrition in Brooklyn and in New York City. As it turned out, some of the individuals that were admitted to the hospital in Brooklyn, this Norwegian hospital, subsequently died. It took the New York City officials some time before they acknowledged that this influenza pandemic had come back to New York City. As a matter of fact, 2 days later, additional ships from Europe landed in New York City and brought more disease. So by the time we got to about mid-August, the disease took hold in New York City. And just like we saw what happened in COVID-19, the disease started killing people in New York, in Boston, in Philadelphia, all along the East Coast, went down to the south of the United States, eventually to the west, and eventually permeated the center of the country. We'd never seen, certainly within, since America was formed, we had never seen that type of pandemic where so many people died in such a short time. As a matter of fact, we often like to compare the 1918 pandemic to the pandemic of 2020, the COVID-19 pandemic. And there are really a lot of similarities, but there are some differences. As I mentioned earlier, when I started my career, there was an HIV pandemic. But this virus that caused HIV was a slow virus. People didn't die all at the same time. You know, people got infected, they lived for a few years with the disease without treatment, Many of them would die within a few years, but it happened slowly over a period of time. As a matter of fact, in the 40 years that we have had HIV, the HIV pandemic, 30 million people eventually died. But in 1918, with that influenza pandemic, almost 50 million people died worldwide within the period of about 2 years. And most of them died within a short time, the fall of 1918. We see a similar pattern in this COVID-19 pandemic, where a lot of people died within a relatively short period of time, overwhelming the health systems in many major countries. So pandemics differ depending on the organism that causes the disease. But what is clear is that most of the time when a pandemic starts, the doctors, the health professionals are dumbfounded as to what started it, what the actual organism that's causing the problem is, how to treat it, and there is always a feeling as if, yes, we've got this, and later on, we really didn't have it. It's the disease just doing its thing, going along its way, the way nature actually operates. So how do I come back into this? Where do I fall back into this? So my medical society, the Medical Society of the County of Kings, we pretty much followed this pandemic for throughout the fall of 2020, and we saw the various ways. We made recommendations on how Brooklyn and the rest of the society should deal with it. But something changed. What changed was in December of 2020, we came up with a vaccine. And this vaccine became the main way in which the pandemic was approached. As a matter of fact, one of the things that the society implemented was the concept of a vaccine passport. That's the concept where your privilege in the society would be based on whether you're vaccinated or not. In addition to the concept of a vaccine passport, there was almost sort of a belief that the vaccine would allow us to return to a normal society. And it's unclear whether the experts actually truly believe that, because that has never been the case. We've never had a treatment in a pandemic that just stopped the pandemic dead in its steps and then we just return. It's a battle between nature and man. And there is no way that, if it really did become a pandemic, that we would have had the knowledge, the skill, and the tools to stop a disease like COVID-19 or the influenza pandemic of 1918 or the bubonic plague, the Black Death of 1346, 1347. There was no way in which we had the tools to just stop it, but we believe that we could. So where are we now? We're in a situation where we need to figure out what are the next steps. So here we are in November of 2021, and there are just as many questions as answers. It's not clear how this COVID-19 pandemic started. Did it start in a wet market in Wuhan? Some say it may have been a lab leak in Wuhan. What we do know is that it's worldwide. We don't know when it's going to end. As a matter of fact, this week we're seeing the worry, the fear internationally of a new variant. Will the vaccines work for this new variant? What are the long-term effects of these vaccines? They have been around long enough for us to know the long-term effects. As we move now to vaccinate people, not just once, not twice, not 3 times, but we're anticipating that the vaccinations will continue. Are we using the right vaccines? What are the long-term effects of the vaccines? What are the long-term effects of COVID? Is the vaccine as good as the natural immunity acquired from getting COVID itself? How should we move forward with our society? Do we still wear masks? This is my N95 mask. Should I wear this when I'm outside in a group of maskless people? Should the person cooking my food always wear a mask? Should the person serving my food always wear a mask? Should we open up and start having parties? Should we open up Broadway? Should we be going to plays? All of those things. Is there going to be another wave? Is the next wave going to be worse than the previous waves? How many waves are there going to be? So we don't know all of those questions. What we do know is that it will end. And what we do know that it's not over yet, because we're seeing on the horizon actually new variants to this particular virus. So do we fold up and just surrender? No, obviously we don't. We've seen the society get stronger in many ways. We've also seen the society get weaker in many ways. We've seen shortages. Many of us in America has never had shortages to experience shortages to the extent that we're experiencing shortages, or with respect to supply chain and even just getting food to people. We have not seen this, most of us, in our lifetime. As a physician, I've never seen this time. I started out in medicine writing on paper. Then I started creating my notes in electronically. And now I do more than half of my medical visits via telehealth. So there are new things that have that the pandemic has brought, and there are more things that are coming that we haven't even figured out yet. Even though we don't know the answers to so many questions, one thing we do know is that we have a lot of opportunities ahead of us. We have an opportunity to change the society from what it was. We have an opportunity to be more equitable with respect to how we deliver healthcare. And very interesting phenomenon is that when things got down to the wire, we didn't trust our healthcare delivery system. We didn't use our hospitals to distribute vaccines. We didn't use our medical offices or our community centers to test people. We created these structures. We didn't use our healthcare budget or our healthcare insurance system to provide care to people affected by the pandemic. We created whole new systems. And the reason we had to is because the systems we had were inadequate. The one problem with that is when the next pandemic comes, we may be doing the same thing again. We've not invested enough in our infrastructure, our healthcare infrastructure. We have not changed the basic way in which we finance healthcare, our healthcare delivery system. We've still not removed our healthcare financing from the employers. Remember, employers shut down. Many people lost their jobs during the pandemic at a time when they needed their health insurance. So those things, those are opportunities that we have now. We have an opportunity to fix that. We have an opportunity to make our healthcare delivery system more responsive to the diseases that affect us. Because remember, COVID right now is epidemic. It's occurring at a higher rate than this virus would normally exist in the society. This viral infection would exist in the society. But it will become endemic. It will become a part of the diseases we treat on a regular basis. It will become a part of the influenza treatment, the measles treatment, the mumps treatment, all the different things. The vaccines we have now will become a part of our routine vaccines. Should we be always getting our vaccines in the pharmacies or in little mobile units on the corner, or should we be going to our healthcare, our usual healthcare delivery professionals to get it? Shouldn't you be getting your vaccinations from your doctor? Well, that's not the case today. Shouldn't your hospital be the place where you get tested for diseases? That's not the way it is right now. So we have the opportunities, we have the opportunity right now to change all of that, to fund our public health system and make it responsive, so we don't wait 3 months before we have a test for a disease where a test already exists internationally. That's what happened with COVID-19. It took us 3 months to get a test for each American, yet the test existed worldwide, 3 months before that. So we have an opportunity to change this. We have an opportunity to have a public health system that will pick up early disease and not just pick it up, but deal with it right away versus waiting months until the disease take hold, till that logarithmic exponential increase in this disease, gets to a point where so many people die and our hospital systems are overwhelmed. So there are lots of opportunities there. So we can change our healthcare financing system, we can change our healthcare delivery system, and we can also make our society more equitable, where not only a certain segment of the population bear the brunt of the disease. I go back to that story where that steamship came into New York with the diseased people, the people who the doctors thought, oh, it was just pneumonia, it was not influenza. And, well, they pointed out, the officers on the ship, their opinion was, well, the reason why the disease came on the ship was because we had a third-class passenger on the ship. And the disease took over the ship because the third-class area was where it took hold. Well, maybe it was. Maybe because you're in third class. If you're in third class, you're going to be on the ground. You won't have good ventilation. You do have a third class ticket probably because you couldn't afford a better ticket, and you're likely to have come from, to come on a ship into third class with a worse nutritional state than somebody in first class. So we have opportunities to fix this, because if a disease affect one human being over here, all human beings everywhere are susceptible. We see this now with the new variants. Yes, in America we have vaccines that we can vaccine every individual, every American, not once, not twice, 3 times, 4 times, as many times as they want to be vaccinated. But we have so many parts of the world where very few people have been vaccinated. So we have these opportunities, and hopefully we will take heed and we will do the right thing and fix some of that, make healthcare more equitable across the board. So what can you do? We need to change the way our society has been going. We're going in the wrong direction. We're living on top of each other. We need to give ourselves more space. You give yourself more space through our governments mandating building codes that provide us with better ventilation. We know these pandemics are spread through aerosolized spread. We know it's contact. So we need to give ourselves more space. Individuals need more space, and we can regulate this. When we do get sick, we don't need your care to be that of a privilege. We need to take care of each other. We're a herd. We're moving together as one. If one in the herd fails, it puts the rest of the herd at risk. So we need to make sure that we have universal health insurance for everybody. Every human being. Every human being should have access to care. So we can fix these things. We can regulate these things. We can legislate these things. So there are things that we can do. Again, we need to focus on public health. Our public health system is where we do prevention. It's where we do early intervention. And it is where we protect ourselves as a group. So there are lots of things you can do. And these things, many of them are political actions. So you can do something about the next pandemic. You don't have to be a victim. We don't need bodies lining up where we can't find a space to bury people. That should have ended in 1918. That should have been the last time. It shouldn't have occurred after 1347, 1352 when we had the Black Death. And it should definitely not have occurred in 2020 during our COVID-19 pandemic.